national TV host and fitness instructor. And here's my friend, Dr. Jill Gamberg. How are you?
Oh, great. Thanks for having me.
And you've become a great friend of mine. You're a client of mine. You've taken my classes. What is it that you like about taking my classes?
Well, first of all, it's awesome fun. Smile from ear to ear when you're doing it.
It is fun. So you would recommend it?
Absolutely try out her class. It is super fun and really safe and well done and thought out, and I think that it's a really great class.
Oh, thank you.
I like also the fact that you offer lots of options. So, for example, postnatal women need to take it a bit more easy, but even someone like myself who's not postnatal anymore, my kids are 6 and 8 now, but I might have other issues. I've got a sore back, so I don't do high impact exercise in general.
Yeah.
And I like that you offer options.
But she is always working it, doing the low impact exercises.
That's right. Just because it's low impact doesn't mean it's not hard work. It doesn't mean that you can't sweat or you can't get a good burn or good pump, a good exercise, challenge your cardiovascular system, strengthen those muscles. But I love that you give options.
Yeah, thank you. So we're coming to you from Sydney, Australia. I also want to make an introduction to my 10-month-old baby boy, Brooks, as always. And as always too, I really want to make sure that you are working out in a safe and effective way. I try to do that as much as possible, but these workouts are not individualized. So I do recommend getting medical treatment, making sure you see your doctor, and also go see a women's physiotherapist. A lot of my friends back in the US have said, wait, what is that? Nobody told me I should be doing that. If you can explain why that's a great thing.
Well, first of all, I think it's important to get your clearance, your medical clearance from your doctor or obstetrician. But then once that's, you're given the all clear, people don't know where to start. And I think really going to see an expert about it, a women's health physio, that's what they do. I think that a lot of women are not aware that they might have an injury or an issue after birth unless they go and talk to someone who knows what to check for.
Yeah, okay. And they're checking our pelvic floor health for abdominal separation.
Yeah, that's exactly right. So they'll check to see whether you have that diastasis recti or the separation of the abs, which a lot of women, really common, but a lot of women don't know they have it. And then as well, just in general, your pelvic floor, how strong it is. You need to make sure to maintain your continence. So yeah, that's something we're going to talk about. And we need to make sure those muscles are working and that women are aware how to work them.
Yeah. So tell us what happens in our 6-week appointment, in the appointment that all of us go to.
Oh gosh, the list is long. But just in a nutshell, we need to assess women's moods to make sure, because postnatal depression is quite common. So we need to make sure that you're coping well with all the sleep deprivation and all that. We check to make sure you're not having issues with breastfeeding. So we look at the breasts and make sure there's no signs of a mastitis or infection and that the feeding is going well for both mom and baby. We check as well down below to see if if the birth injuries are healing, if there are any, if there's any stitching of any of the areas. Even if you've had a cesarean, there's also stitches there. So we check all of that stuff. And as well, we just get a feel of how the mother and baby are coping in general.
These little guys can keep us awake at night, waking us up in the middle of the night, early in the morning. How does sleep deprivation impact our weight loss efforts?
Sadly enough, even though it's a natural thing to be sleep deprived, when you're sleep deprived, it's much harder to eat healthy because your mood is low, you're irritable, you're angry, you just don't feel good about yourself. And unfortunately, it changes your brain chemistry. And the brain chemistry, those happy hormones that we normally have, let's say when we do some exercise or when we're not sleep deprived, we have better decision making about the foods that we're eating. But just like at the times of the month, when you're not pregnant or breastfeeding, when just before you get your period, often people get PMS and they feel that sort of urge to eat naughty foods or foods that we shouldn't eat all the time. You have that same sort of drive innately from your hormones when you have a baby. So the key is, if you feel like having a piece of cake, have one. But you got to try and find ways of not doing it all the time. Yeah. Otherwise you will gain weight and you will be unhealthy. And then it's just like a process that feeds itself. So I think
So are the hormones that we're producing, is it that they make us want the junk food, or those hormones are actually making us hold on to the extra fat stores?
Both. Yeah, both. So you sort of have everything working against you. So again, I think it's important to be patient with yourself and your body as you recover. And I think it's also important to find ways to manage those feelings, to manage those hormones. You can't change them. So you just need to find ways to manage them. So that's why I say sometimes if you need to eat the biscuit, but not every time. So finding a way like going for a walk, calling a friend, doing something productive is ways of changing that desire to do something that's less healthy.
Strong Sexy Mamas is also all about having a positive body image. We do want to get our pre-baby body back, but we need to have realistic expectations for that. How can we make sure that we're feeling good along the way, enjoying the journey?
I think if you set the wrong expectations for yourself from the beginning, you expect 2 months postpartum, postnatal to look amazing and have the six-pack, you're just setting yourself up for disappointment.
Any tips you have about having a good positive body image after having a baby?
Well, I think you need to just be patient with yourself and be kind to yourself. Things will get better with time. You will get your body back if you work hard at it, but it's closer to a year. Really and truly, you got to think about that. So if you put your long-term goal at about a year, that's much more realistic, and then you space out the, like we were talking about in the beginning, you just start to think about bracing and pelvic floor, and then when you hit your 6 weeks and you get your check, you can think about low impact exercise, and then as long as you don't have any issues, you're thinking about high impact maybe around 4 or 5 months. Again, with the guidance of your doctor and your pelvic floor physio and great people like Anna who teaches how to exercise safely. Then if you have slow goals, short-term goals, we can reach that safely, long-term goal of having the post-baby, pre-baby body.
Yes, and you said that to me so many times. I'm now 10 months out with him. You said so many times to me when I was pregnant, it's going to take you a year, it's going to take you a year, and I kept going, you just wait, you don't know me, and you know what, I'm at 10 months and I'm not there yet. I've started working in a lot of high impact exercises, but I'm waiting for the time when I meet the 1 year mark to really turn up the dial 100% because I don't feel 100% yet.
That's right. And look, the other thing that's really important is actually you'll never be back to your pre-baby anything because now you have these beautiful children.
No.
And so I think that's important to realize as well. I don't think we should expect to get back to pre-baby. Who wants to?
I don't.
Let's just be proud, strong, sexy mamas, right?
Yes. And why should new moms involve themselves in low impact exercise before high impact exercise?
So once you got a proper awareness of the pelvic floor and the lower or the inner abdominals, then we can start thinking about low impact exercise. And I wouldn't be starting that really until about 6 weeks, until after you get your check. Once you do the low impact exercise and you can get your body really into it, in about 2 months after that, probably not before 4 months if you're healing really well and if you've been given all the all clears, can you start really into your high impact exercise.
That's running, jumping, jogging, things like that.
Exactly. So in the beginning you should only be walking and doing some strengthening exercises, but your jumping, your skipping, your high impact dancing really shouldn't be till about 4 months.
And the same goes for heavy lifting, is that right?
Yeah, that's right. So you can definitely engage in low weights at the beginning, certainly from 6 weeks to start strengthening up your muscles. But really the heavy weights where you're holding your breath, or you should never be holding your breath, but people tend to hold their breath, shouldn't really be till after 4 months.
Well, I know that celebrity trainers teach their clients to use their transverse abdominis instead of their rectus abdominis, their six-pack muscles initially. So it's a nice celebrity secret that we're sharing with all of you at home. Why is it that those muscles, if we work them first, will actually help us flatten our tummy?
Well, basically just from even the first couple of weeks, you can even just start bracing. You can start thinking about having an awareness of those muscles being contracted, doing some good deep breathing exercises, and really just practicing bracing. And then if you get that safe position, you can then slowly engage in some of the exercises you're talking about.
Yes, the bird dog crunches and the hill slides.
That's right.
Okay.
In order to get the six-pack muscles to work, you actually have to work the underlayers first. So that's the transverses and the obliques. Basically, they've all been stretched out for 9 months. And so when muscles are stretched, they don't work well. They don't, the sort of brain-body connection has been broken. It's not a broken that can't be fixed, but it just needs to be, you just need to do things in order to try and get them to sort of get back to normal.
So why can crunches and planks and sit-ups be bad for some moms early on?
Yeah, absolutely. So those kind of exercises, unfortunately, people tend to hold their breath. And that increases the pressure intra-abdominally. And what that can actually do is damage your pelvic floor and your lower or your inner abdominals. You can actually cause them to balloon out or get injured if you're not bracing yourself properly. And if you haven't started your exercises in a safe fashion, then if you go to the too hard ones first, you could end up hurting yourself.
Which abs exercises are recommended early on?
Certainly in the first few weeks, bracing is the #1 thing. And then you can progress to bird dog crunches and meal slides and something a little bit more gentle. Or you can see the physiotherapist like we talked about, where you can get some really specific rehabilitation exercises. Once those muscles are starting to work and getting strong, then you can progress to things like planking, regular sit-ups, crunches, the kind of things that everyone thinks are normal ab exercises.
It's all about the order, isn't it? Just early on, we need to just start with the bracing, then we can move on to the heel slides and bird dog crunches and cat cows.
Absolutely, it's the progression that's important. I think people don't realize that they need to start slowly to then progress to the stuff that everyone wants to do.
Right, and I guess the same goes for abs exercises as everything else. We don't want to be loading with a lot of weight in the beginning.
Right. That's right. So it's really about breathing so that you're not holding your breath in whatever you're doing. That's really important. And just being patient with your body, allowing it time to heal, I think is really important.
So what's the proper way to do a pelvic floor exercise, or a Kegel as we call it in the US?
Well, I think the key is you got to think about what part of the anatomy, what part of the body we're actually using. And look, people don't like to talk about it. So
yeah, it's a taboo topic. People don't want to say the word vagina or anus. But look, we're going to say it. We're going to say it.
Because that's the area of the body that we're talking about.
It's anatomy.
You know, your baby comes out of your vagina. So those muscles get really stretched out when you have a baby vaginally. And even if you have a cesarean, those muscles get a lot of pressure on them for 9 months of pregnancy. They can get very weak. So when you think about a Kegel or a pelvic floor exercise, you got to think about those muscles that nobody wants to talk about. So let me tell you about how to do it. Basically, you know, women that have had baby have had sex. So let's talk about sex. When you have good sex, you're contracting those muscles in your vagina, and those are the muscles you want to think about contracting when you're doing a Kegel.
And if we do our Kegels and we do our pelvic floor exercises, I hear you saying we're going to have better sex likely too.
Absolutely. The more Kegels, pelvic floor you do, the better sex you're going to have.
So I think dads are going to like this one as well.
Absolutely. The other part we need to talk about is the anus. So again, that's where your poo comes out, but every day of your life you've always concentrated on how to, squeeze that in and out. And we don't like to talk about that. But when you have birth, when you give birth, or even being pregnant, again, those muscles get weak. Yes. So part of the pelvic floor is contracting the anus as well. So again, you're just trying to have an awareness in the beginning of contracting those vaginal muscles and the anal muscles.
And drawing in and up.
And drawing in and up. And then as you get better at it, you can start to feel all the different layers and just get better at contracting those muscles and retraining the brain-body connection.
And why is it that the release after we've done the contraction is so important as well, that relaxation? Why is that important?
Well, because we don't walk around all day with, holding it all tight. You do walk around with your muscles relaxed most of the time. And so the key is when your muscles are relaxed and you do a straining maneuver, like, we can't control a cough or a sneeze. You got to remember how to go from that relaxation movement to, oops, I'm going to sneeze, quick, let's tighten those muscles up so I don't have incontinence or an accident. And even if that's just a little bit, obviously it's something that women don't want to experience.
Right. And we keep talking about the transverse abdominal muscles, or the TVA. They do work together with the pelvic floor. So when you're helping to make your tummy flat again, it's not just an appearance thing, it's also a function thing. Why is that?
Oh, absolutely. So what you need is to have, basically it holds all your intestines, it holds all your stuff, your organs in there. So it's really important to retrain those muscles to keep everything in place. It'll function better, your digestion will function better. Everything that goes on down here, it will function better if you strengthen up all your pelvic floor and your abdominals.
If a patient comes to you and says that they want to involve their baby in their exercise using a baby carrier or the baby instead of a weight, what advice do you have for them?
Well, in the beginning days, you need to be careful if you're in a baby carrier, specifically with little babies, because obviously you have to make sure they're safe breathing. Because little ones don't have good head control, and you could easily smother them or suffocate them. Obviously, no one wants to do that. So as long as they're in a safe position in the baby carrier. Now, obviously, if you're lifting your baby, you're going to be careful with them. But again, you probably want to wait until you're lifting them up in the air until they have that good head control. Yes. And usually that's about 2 months, but every baby's different. So as long as you can certainly have fun. I mean, for the bonding experience part of it, that's wonderful for the mums and bubs. That experience of exercising with your baby is great. But again, you need to let your baby go through their own progression of exercise, learning to have neck control, learning to turn their head safely, and then, just have fun with the baby once it's safe.
Okay. And how about ourselves? Because carrying a baby is a weight. So what about women's health when we're exercising with our baby?
That's right. Obviously, your babies gain weight, and so they get heavier. So if your baby is a baby on the larger side, perhaps likes to breastfeed a lot, sometimes that can cause a bit more strain on your abdominals or your pelvic floor or your back or your arms. So again, if your baby's too heavy, then maybe you want to do your exercises where they're lying on the floor, sitting in the pram, or playing on the floor, and you can even use no weights.
Yes, and that's an option that I always give folks in the Strong Sexy Mamas program, is that, look, if you aren't working out with your baby, and sometimes it's just because they're being fussy or because they're taking a nap, instead you can use very light weights or just your body weight.
So again, it's about safety for mom and bub, and about that bonding experience of just being together and being able to exercise.
Great. And how will we know as new moms if we've been pushing ourselves too hard?
Well, there's a lot of things that can happen. One is you can feel really exhausted. 2, you can have a low mood. 3, you can injure yourself. You can actually cause hernias, you can cause incontinence. These are things that you don't want to happen.
So if we're feeling things like a heaviness in our pelvis, or what else do we need to look out for?
Well, certainly if you have an accident, that's something that you push yourself too far, and even though people don't like to talk about that, it can certainly happen. So definitely that's a no-no. If that happens, you want to talk to your women's
And that goes
physio.
for even leaking, right?
Yep.
That's not a full accident. That's
right.
If you're leaking or if you're feeling a heaviness, then you need to stop.
You need to stop exercising and talk to your doctor or women's health physio. So that's a really important one. If you feel any bulges or uncomfortable heaviness or something isn't right, trust your body. Stop exercising, go and talk to someone.
Well, let's talk about the proper way to do a pelvic floor exercise, a Kegel, as we say in the U.S., because it is very important. These continence issues that many of us deal with when we have a baby can be fixed. They can be cured, right?
Sure. Again, if you start in a safe, progressive manner, then you're less likely to injure yourself. So what you need to do is, even from day 1, if you're not too sore, you can start thinking about contracting those muscles. And one of the easiest ways that I tell women is, once you're peeing, because everybody pees, you actually just try and stop the stream. And just even having that awareness of trying to tighten those muscles nice and gently without hurting yourself can be done from day 1 or 2.
Okay, I had a midwife tell me at the hospital the best thing to do, just because it's hard to even remember to do them. She said, every time you're breastfeeding, just try. And she had me hold it for the number of weeks that he was, and do that 10 times. So if he was 1 week old, hold it for a second, and that can be hard for even just a second in the beginning. And then at 2 weeks, she said, hold it for 2 seconds and do it for 10 times. Are you waving? Is that good advice, or what would you say?
That's great advice. I think the key is, you're so busy worrying about your baby, worrying about your body, thinking about feeding, sleep deprivation. The last thing you want to think about is your Kegels or your pelvic floor, right? But the key is, if you think about it, do it. So, if you manage to do it 2 times a day in the first couple of days, and then by, the 6 weeks you're thinking about it 10 times, great. If you have a day where you forget, don't worry, no pressure. Just do it when you think about it. I think that's the key.
And Dr. Gamberg, that is a big difference in my program than a lot of others, is that I often lead a short basic pelvic floor exercise. I'm not a women's physiotherapist or a pelvic floor expert, but the reason I do it is because I know it's something we should be doing every single day.
Yeah, I think it's really nice that you incorporate those kind of things into your program, because certainly in postnatal health and women that have just had babies, they need to be taught how to think about training the pelvic floor and training those transverse abdominals before anything else. To just get back to being women, healthy women, happy women.
Yes. Dr. Gamberg, thank you so much for your time. This means the world to me, and I'm sure to all of my members at home from Strong Sexy Mamas as well. Thank you, thank you, thank you. Great information today.
Thanks, my pleasure.